Dr. Narendra Singh. Thank you so much for joining me, and I heard you brought Jessica Baumgardner with you.
Yes.
Thank you so much for being here. I'm going to start with you, Dr. Singh. I would like for you to tell us what the acronym PSVT stands for, and what are the symptoms and how patients typically diagnosed.
Yes, thank you. PSV, it is a mouthful. It's paroxysmal supraventricular tachycardia, and it is a rhythm disturbance of the heart. Over 2 million Americans have it, where your heart just suddenly starts racing really fast to the point where it's going to cause you chest discomfort, lightheadedness, dizziness, and in the worst case scenario, a fainting episode. In order to treat,
Go ahead. I'm sorry.
Yeah, no, in order to treat it, we've got to get you to the emergency department while this is happening to get an EKG. And then once you've made the diagnosis, then start an IV and give you a medication to terminate the fast heart rate.
Okay, so the fast heart rate, let's be clear about that for those people who don't know. It's not because you were running. It's not because you saw something that really scared you. You know, maybe you're just standing still and start getting this fast racing?
Yeah, that's what's very disconcerting about this is that it can happen at any time. And while there are triggers, certainly, caffeine, energy drinks, lack of sleep, emotional upset, these are all potential triggers to put you in it. But for many patients, it can happen just out of the blue. And that's what's distressing because you don't know when it will occur. And then you don't have, up until now, easy treatment options.
Okay, and if I could just prod you a little bit more, you're so on target with the caffeine drinks and the coffee and the stimulant. Will a person be able to tell the difference than drinking, 2, 3 energy drinks in a row?
Yes, and that this is not going to be just your average heart rate going faster. This is going to be a sudden onset and associated with significantly more symptoms when this occurs. So you feel it. And certainly, I mean, Jessica will be able to describe more. She experienced it in terms of, how you will feel.
Okay, we'll talk about the treatment in a moment, but first I'd like to switch to Jessica and ask you, Jessica, could you give us a little bit more about you being diagnosed with PSVT?
Sure. So I was diagnosed with PSVT almost 20 years ago now, conveniently in nursing school. I was sitting in lecture, and all of a sudden, my heart rate shot up to 180. I was very short of breath, having chest pain. I became shaky and really thought I was going to pass out. Lucky for me, I was able to get to the emergency room pretty quickly. And the first episode I had, they were able to identify on an EKG. So I was able to seek treatment pretty quick.
Okay,
And
so go ahead. I'm sorry.
oh, I was just going to add, as Dr. Singh said, it's a very distinct, these symptoms when I feel them. It's very different than, as you mentioned, if I went for a run and had high heart rate. This doesn't, slow down gradually. It happens very suddenly, and you get that associated chest pain, shortness of breath, lightheadedness. So it is very distinct feeling.
Okay, so once you have this episode in your life, is this a lifelong thing? And how does it affect your daily life, if it is?
So for many patients, this is a lifelong, journey that they're on with SVT, like myself. So it's very unpredictable. You can go days, weeks, months, sometimes even years without having an episode again, or you can have 3 or 4 episodes in a week. And because of the nature of the symptoms, how it makes you feel, it's very hard for patients to, go away from where they could get medical treatment, where you don't know where an emergency room is, or to be isolated for fear of having an episode and not being able to get somewhere for help.
Okay, you answered my question. How do you feel on a daily basis? And you have tapped into that. So I'm going to talk to Dr. Singh. Dr. Singh, are there any new treatment options or old treatment options? And how do you treat your PSVT patients?
Well, now Cardamist is actually the first self-administered nasal spray that is FDA approved. And what this does is give us an excellent option for our patients who have these episodes of PSVT that they don't know when it's going to occur. By having this therapy, All you have to do is take one spray in each nostril, sit down, and as early as 5 minutes, you can start seeing relief. And certainly the majority of patients by 30 minutes will have gone back into their regular rhythm. So it really does change our approach to treating this condition.
This is a new treatment. I remember in the prior years growing up, and when a person had a heart condition, they took this thing, I think, called digitalis, and it gave them immediate relief. Does the nasal spray, it's kind of like that?
It is, but digitalis is used obviously for a different type of rhythm condition. And this one for PSVT, yes, you will see often instantaneously that you're back in the regular rhythm and relief of your symptoms. And so very similar to how people carry an EpiPen for allergies or carry a rescue inhaler for their asthma, this is now going to give our PSVT patients an excellent option outside the emergency department.
I like that analogy. And I'm going to get one more question for you, Jessica. I know you're excited about this treatment. What does this do for your everyday life?
I think for my everyday life, I don't have to worry about where I am, who I'm with, if I'm close to an emergency room, especially traveling. If you're on a plane, you have something that's portable, that's easy to use, and it really puts control back in the patient's hands. And it makes you feel sort of this new freedom to not have to worry about where the closest emergency room is.
Okay, I'm going to take this one from Facebook because my audience is spread out on multiple platforms, and this is for you, Jessica. They say, with this new treatment of a nasal spray, do you tell others around you so that they can be prepared also, or do you keep it to yourself?
I think that's a great question. In the past, I've been kind of embarrassed when I have these episodes because the people around me can definitely tell something's happening. For me, I think I would specifically, my family, my husband, tell them I do have this medication so that they can help you get to it if you need assistance during these episodes.
Jessica, I want to thank you for being on the planet to share your story because I'm sure you have changed someone's life. Dr. Singh, I'm going to wrap up with you. Tell me about the safety of this treatment because it sounds so simple.
Yes, and what's exciting about it is that it's also very safe. So you get great efficacy. The main safety issues, sit down when you're taking it in case it affects your heart rate and blood pressure. When you take the spray, you may get some nasal irritation, a little bit of throat irritation, but that's very transient, resolves very quickly, and so very easy for our patients to use.
Online, where can those who are listening that may have a buy-in to this, where do you get more information?
An excellent website is cardamist.com to get more information. Of course, talk to your healthcare provider as